It's equally important for public health and GPs to work together to continue to improve patient care. GPs are on the front line and can successfully influence patients to make the right choices for their health. Dr. Paula Gray, Director of Public Health in Liverpool, explains the roles of GPs in the future and how public health can support them.
GPs have a very important role now in terms of meeting the needs of the population. As the health service changes come into effect, the GPs will be taking responsibility for the health care of the whole population. So in Liverpool, they will be responsible for the health care of everybody in Liverpool. So we need to work with the GPs to ensure that they are actually providing the kind of services that people in Liverpool need. And from a public health perspective, we can provide them with the information, the intelligence, the understanding of what people in Liverpool need, what their health needs are, that will help them to provide the kind of things that their patients need as they come through the door. Very important for public health to work with the health service. Obviously, the health service plays a critical part in improving the nation's health. And GPs are the primary interface of the health service with patients and public. So it's very important that we work with GPs to ensure that the services are designed to meet the needs of the public, and that actually they're fairly spread across the whole of the Cheshire and Merseyside area.
A recent example of GPs and public health working together is the Bowel Cancer screening project in Cheshire and Merseyside.
The Bowel Cancer screening programme is a fairly new screening programme that's been introduced nationally over the last few years, targeting people between the ages of 60 and 75. It's not an easy screening test. People have to give a stool sample that then gets sent away to be analysed, and obviously there is some reticence sometimes in people not really wanting to do the test or not quite understanding what it's about. So our programme was about trying to support GPs in making the screening programme understandable to people and actually encouraging them to participate. Because obviously the more people who participate in the screening programme, the more successful the screening programme will be, and then the more potential cancers we may find and be able to treat and cure.
As a GP, it was important I was involved in the bowel screening project, because traditionally the bowel screening project had been run by public health with little primary care involvement. I saw it as my job to try and help bring primary care into the picture and get some coordination and involve the patients more. Working in partnership with public health has made a big difference to our population's health, because traditionally public health was very separate, and now we're working together and we're understanding exactly what they do and we're trying to coordinate it. Nowadays we speak to the patient about those public health issues and get the patient on side. So they're not surprised when they get things like the bowel screening kit through the post. They know what it's all about and they know that they've got our support.
For the first time, GPs have been involved in following up the results.
The bowel screening project is run by a central hub coordinated by public health. The patients get letters to test their faeces to look for blood which might indicate cancer. We get the results of that, but we've never had any involvement. The bowel screening project was we were involved, so we knew all the patients who had not responded to that. We could contact them, we could speak to them, we could understand what they felt about it, why they hadn't completed the kit, and it meant we'd question them when they came to surgery and coordinated it with the rest of their health care.
Why is partnership working in the new system so important?
It's becoming more important that GPs and public health work together if we are to manage the growing number of health needs in the population. And from my perspective, I think it's very important that we use the Health and Wellbeing Board, which will be there for the whole population of the city, and agree there between the GPs, the council, the third sector, all the partners there, what the priorities are for the city. And then following on from that, we then need to start to focus down on the issues that we can really support the GPs on. So issues where public health and primary care can work together, particularly around things like understanding the population more, the kind of programmes and campaigns that you put in to try and encourage people to come forward for treatment or for screening, and supporting people who might not usually use their GPs, so people who may not be registered, people who are in situations where they may not come forward for primary care, making sure that they actually participate in the services that we provide. They're people who may be easy to miss, but the people that we really need to encourage to come forward.
The Bowel Cancer Screening Project is a really good example of collaborative working with a shared vision and a focus on individual needs. As a result of the project, uptake rates for bowel cancer screening in the GP practices that took part rose by 11% overall, against a target of 5%, potentially saving lives. By working together and putting public health at the heart of their thinking, GPs can really make a difference to the health and the well-being of their patients and of the population as a whole.